All right, we're back. Tree Country 1330 WTRE. It's time for our Decatur County Memorial Hospital Health Chat. Kathy, if you'd introduce our guest.
Oh, good morning, Tom. We
Morning.
have Lindsay Hines with us today. We are talking lung health, and Lindsay's a nurse practitioner at Decatur County Memorial Hospital. So thank you for joining us today.
Absolutely. Good morning to everybody.
So tell us a little bit about the practice that you're with, and tell us a little bit about what we need to do to have good, healthy lungs.
Sure. So I originally came over to Decatur County Memorial Hospital. I was recruited by Dr. Ferry, a fantastic pulmonologist who unfortunately has retired, but so grateful for him and to everybody that he has treated and helped throughout the years here at Decatur County. Our practice is a very busy practice. We see lots of patients that range from asthma, COPD. We also see lung nodules and potentially lung cancer. One of the biggest things that we need to do to keep our lungs healthy is to stay active. Also try to avoid smoke, pollution. Vaping is now a big thing that we need to try to reduce, and especially talk to our young kids and teenagers about the dangers of vape lung injuries. So absolutely trying to be healthy and stay away from smoke for lung health.
Tell us, Lindsay, when we talk about vaping, give us kind of tell me what's the difference. Smoking, we've grown up knowing that that's, really hard on our lungs, but vaping was supposedly a better thing. But,
Yes.
we hear a lot of negative. Can you talk us through that?
And unfortunately, we have so many patients that try to quit smoking by transitioning to vaping. The problem with vaping is that there's these hot liquids and chemicals in there that are not in cigarettes, right? And these also have nicotine products in them too. But a lot of these effects are still unknown. What do these hot liquids and chemicals, what they can actually do to your lungs? And so originally, about 5 years ago, we started hearing about vape lung injury. You might have heard of it as popcorn lung. And we do see that still being the case. A lot of this was associated to flavored liquids that are in the vapes. And so some of these are trying to be more regulated, but there's still not a lot of regulation, and we really don't know what's in these vape products.
That's what I was going to ask.
Yes.
What's in the liquids?
Right, and so a lot of it's not regulated, so we don't really know what is in these products. And, teenagers, of course, they think it's cool, but we really don't know what we're smoking and what we're putting into our lungs. And it's super dangerous, and so we need to try to avoid it at all costs.
And a lot of people you talked about, they use that as an alternative to smoking. Right. People don't realize how addictive vaping is as well, maybe even more so.
Right, and that's the thing. I mean, pick your poison, right? And so trying to get away from all smoke products is ideal. Challenging, though. It's such a hard habit to quit. And that's one of the things, too. We, as a pulmonary practice, we're here as a resource for you to help you quit smoking and vaping. It's not something that we think you're going to quit tomorrow. This is a challenging habit and very addictive. And so we're here as a resource. We also have a tobacco cessation program through Decatur County Memorial Hospital. And so that's a really proactive program and trying to keep you accountable and trying to help you through that process. So we have lots of resources. Just reach out. Even if you're not a patient of the pulmonary practice, the Decatur County Hospital employees also have that resource available. So absolutely, if you are smoking cigarettes or vaping and you're interested in quitting, please reach out to your providers to see about that tobacco cessation program.
Okay. All right. Yeah. Get through the smoking thing. I mean, it really takes the years off your life quickly, doesn't it?
It does. Smoking is the number one reason for COPD and lung cancer. And unfortunately, years past, it was pretty normal, right? Lots of people, grandparents were smoking, parents were smoking, and so then, people were smoking at younger ages. I think we've done a pretty good job in now, understanding all the risk factors associated with it and what does that look like for people, but it's such a hard habit. And so we still have a very large smoking community, right, throughout the country. Poses so many risks, but we're here as a resource.
And there are so many times you see people like myself. I've never smoked in my life, but I had been around a lot of smokers and ended up with asthma, COPD, sleep apnea. People don't realize the effect it has on the people around you.
Absolutely. Secondhand smoke can affect you as well. And even, we have so many jobs that give a lot of chemical exposures, air pollutant, welding, those types of things. So trying to wear PPE and trying to be, protect yourself against those types of exposures as well.
just to be aware all the time.
Absolutely.
What you're exposed to.
Definitely.
Sure.
And this has been such an interesting summer too because of the humidity, right? So it's been
awful.
Yes. The humidity has been so problematic, and the pollens and things. It's been a really hard allergic season too.
One of the things too that I've noticed, and they talk about the Canadian wildfire smoke, but and you're thinking, oh, that can't, but it really, and you notice the dullness in the air or the heaviness, and and I don't think we would really realize that that's even going on.
Right, absolutely. And you think, even if you have healthy lungs and you're young, even with the humidity and you're being active, you think, gosh, I'm a little short of breath, right? Because it's so humid and the air is so thick. So just imagine somebody that has COPD or lung cancer or something like that, asthma, and how difficult it can be. So we absolutely advise, if you do have any type of lung disease, that you try to avoid humidity or extreme temperature changes too.
Okay, all right. So, Dr. Curry?
Yes, so we have another board-certified pulmonologist with our practice. His name is Dr. Curdy. He started with us back in October of last year, and so he is kind of taken the reins from Dr. Ferry since he has retired, and he's doing great work. We're expanding our sleep lab program, and so he is helping run the sleep lab program. So we have a decent-sized sleep lab for sleep testing, and then we also have a CPAP clinic that he is running to get people set up on therapy, and that's going very well. I think, sleep apnea is kind of pushed to the side. People really believe that sleep apnea is just, I don't sleep well and no big deal, but it is a big deal, and it really does affect your life. For, comorbid conditions of heart failure and kidney disease. So it's something that we're always worried about. And if you are having a lot of daytime fatigue, you have an abnormal sleeping pattern, you snore, those are potential symptoms of sleep apnea, and it absolutely needs to be addressed. And so if you are having any of those symptoms, please talk to your primary care provider about it as well, because potentially you may need a referral into sleep medicine for us to further evaluate you and to see Dr. Curdy as well. Dr. Curdy is also seeing pulmonary patients too, so he's not just doing sleep medicine. He's splitting his time half and half between the pulmonary clinic and sleep medicine. We actually hired another nurse practitioner as well. Her name is Lauren Karbowski, and she brings a wealth of knowledge and is doing fantastic. She's been with our practice since about February of this year. So you could see any of us in the pulmonary practice. We work as a team. I think what also sets our practice apart from some of the other practices, especially up in Indy and some of the bigger cities, is that we have great support staff. Our nurses and our MAs, they're fantastic. And I think something that is really different about our practice too is that you're not a number to us. You're a patient to us. We want to get to know you, get to know your family, get to know your lungs, right? And how can we make you feel better, control your symptoms better, and then also prevent any lung disease progression in the future for you as well.
So when we talk pulmonology, tell us different diseases that you treat under that.
Sure. So the pulmonary space is a very big space. There's lots of different disease processes that fall into this pulmonary category. Some of the biggest ones is asthma, COPD. So we have patients that range from 18. So we're an adult practice. So we see patients from the age of 18, and we have patients up to their 100, right? So we see that whole lifespan there above age 18. So we have young asthmatic patients, right? Maybe they saw a pulmonologist as a child, they had severe asthma as a child, and now we're continuing their care as an adult. We also see COPD. That's a big part of our practice as well. Like I mentioned previously, new lung nodules, things like that could be lung cancer. We also run a CT lung screening program, and so that's been very beneficial to Decatur County Hospital. So the CT lung screening program, your primary care providers can also recommend this too. You don't have to be a pulmonary patient, which I think is fantastic. So CT lung screening is for the people between the ages of 50 and 80 who have a smoking history. And as we know, you're at higher risk for lung cancer when you have a smoking history. And so it's like a mammogram, right? It's a screening tool once a year to get a picture of your lungs to make sure no new nodules are found. It's a screening tool, right? And so now we're able to catch potential lung cancer at earlier stages because we're monitoring you and watching you. So it's a fantastic program. Like I said, if you're not a pulmonary patient, that's okay. You can still do the CT lung screenings from your primary care provider. So if you are a smoker and you're between the ages of 50 and 80, absolutely discuss that with your primary care. And then, of course, so how that pans out is that if you do have something suspicious that pops up, you likely will get a referral into our pulmonary practice, and then we'll further evaluate that from there. We also see some of these other disease process that are autoimmune related. So patients have rheumatoid arthritis, lupus, some of these other more rare autoimmune disease process can cause breathing problems. So just like autoimmune diseases can cause inflammation in your joints, it can cause inflammation in your lungs. And so we will see patients with those types of problems. That's called interstitial lung disease. We also have patients for pulmonary fibrosis, so like scarring of the lung tissue, things like that. That's the bulk of our patients. Of course, we've had a lot of post-COVID patients too, right? Maybe we've seen them in the hospital while they were really sick with COVID, and then that long hauler syndrome thereafter, and how do we treat that? How do we evaluate that, and things like that. So we have a big range of patients that we can see. And really the take-home point is that if you are having increasing shortness of breath, chronic cough, you're not able to do your activities of daily living because you're having respiratory symptoms that are ongoing and not getting better, that might be the time that you need to talk to your primary care provider or another specialist and say, should I see pulmonology? What could be going on with this? And I think one of the things that's challenging for patients and for us as providers too is that patients that live with lung disease, they think it's their new normal, right? So maybe last year they were able to walk to their mailbox, and this year they have to stop halfway to get to their mailbox because they're becoming short of breath. And they just compensate. They start to slow down, they take breaks, right? And they start doing it without even realizing it until you bring it to their attention, like, hey, you're no longer able to go to the grocery store anymore. You're having to pick it up because you can't walk through the grocery store. It doesn't have to be your new normal, right? And so I think that's such a big point to make to patients, especially coming from like a primary care provider office. What are you able to do now that you weren't able to do last? Those types of questions, really trying to understand what is their shortness of breath, what does this chronic cough look like for them, and that it doesn't have to be normal. There are great treatments out there. We have lots of options available and things that we can provide in different types of therapies. And so if you're having problems with your breathing, please talk to your provider about it and see if it's time to get that referral into pulmonary clinic.
I do have a question with the asthma piece of it because I know, that's a scary thing.
Sure.
Anyway, but do you feel like over the last 10 to 20 years that we've seen maybe an increase in that? Because I read things where our exposures to things are so much more just lifestyle changes. Yeah. So with asthmatics, asthma, what are you seeing these days?
Absolutely. And we're seeing more severe asthmatics, I believe. And I think it is, right? Our air is polluted. So many of the environmental allergies are affecting people. And then also we've seen a lot of post-COVID. So it's kind of this reactive airways disease post-COVID, and so we treat them like asthmatic patients, and so we've had an uptick in those, post-pandemic. But asthma absolutely can be super scary, and I think the misnomer with asthma is that people think it's no big deal, right? But asthma kills people, so we need to be mindful of our triggers, environmental allergens, and how do we protect people.
Asthma treatment, though, has really come a long way, hasn't it?
Yes, there are so many treatment options now in the asthma world. Before, and so many of our young asthmatics too just reach for their albuterol inhaler, their rescue inhaler, and that's all they utilize. But they're needing to use it every day because, let's be honest, their breathing's out of control. Like, we should not be needing to use our rescue inhaler every day. Our breathing is out of control if you're utilizing it that much. And so we need more treatment. We need more therapy to control these symptoms, because it can be scary and it can be very dangerous. One day you're just normal, you go into an asthma exacerbation, you have a trigger or something, you have an asthma exacerbation, it can send you to the ER, right? So we have to be very mindful about these symptoms and what do we do, and don't sit on these symptoms. If you're wheezing and short of breath and coughing, you need to treat it before it gets too bad. And so we have fantastic inhalers to help treat asthma, but beyond that, we have these newer medications. They're called biologic medications. And it's amazing, these type of medications, they treat specific triggers that we have found to trigger asthma exacerbations. And so it's so much science behind it, and immunology and how our cells works and things like that, and type 2 inflammation. But it really drives down what is triggering your symptoms and your exacerbations, and it shuts down parts of those systems. And it reduces asthma exacerbations, it reduces ER visits, it reduces hospitalizations, and there's a handful of them now that we're able to pick from. And now, primarily, of course, primary practices are not utilizing biologic. These are pretty severe asthmatic patients that are having exacerbations or flare-ups in their breathing frequently, needing oral steroids, antibiotics, things like that. And so if you're an asthma patient, you're reaching for your albuterol more than 2 days a week, you're already on maintenance inhaler therapies, we're still exacerbating, going to the ER and things like that, that might be the time also to get a referral into our pulmonary clinic to explore, do you need a biologic therapy, and to try to prevent disease progression.
So I know you guys do adult practice only, but for the kiddos with asthma, are those same biologics available to treat them?
Yeah, some of them are approved up above the age of 6. A lot of them are above the age of 12. But yeah, so some of these patients are already into a pulmonary practice like at Riley or Cincinnati's Children, things like that. And then we absolutely can take them on past the age of 18 if they're not going to be followed by them anymore.
Okay. All right. So there's just so many different, as we said, with the lungs. I mean, we got to have our heart and lungs. That's all there is to it.
Absolutely. Well, and so as a new patient, when you come in for a new patient visit, it is a very comprehensive visit because there's so many different things that can cause respiratory symptoms. And it's not always lungs. So sometimes we start further evaluating with diagnostic testing and things like that, and we realize it's not the lungs. It's something else that's causing your shortness of breath, right? So we're evaluating your heart. We're evaluating sinus disease. We are evaluating stomach problems with reflux because that can cause chronic cough. So we're really autoimmune disease processes too. So we're evaluating for autoimmune issues as well. So your first visit, typically it's at least an hour of us in there trying to dive through your previous medical history. What are your current symptoms? What kind of medications are you taking? And so our first visit's always a little overwhelming, I think, for patients. But we really are trying to, I always talk to my patients and I say it's a little bit of fact finding. We got to figure out what is causing the problem and then how do we treat it. And so we're not a practice that we're just going to start throwing medications at you and see what sticks, right? We want to try to figure out what is the problem, and then we can treat it appropriately. So your first visit is very comprehensive. We're going to be taking the time to really go through your medical history, figure out what is going on. And then thereafter, your visits start to become a little bit easier because we get to know you, we get to know your lungs, and then get you on the right path to treatment.
So I have a question. Sometimes we know genetics play a huge part, hereditary. Is it much in that area with the lungs, or is the lungs more of a what we
been exposed
individually?
To so no, there are hereditary lung diseases. I'm glad you brought that up. One of the hereditary lung diseases that we see and screen for is called alpha-1. Alpha-1 is a hereditary lung disease that can cause emphysema. And it is more prevalent than what people know. It is out there, but you have to look for it, right? And so we screen basically almost all of our patients. There's an Alpha-1 Foundation, and they provide free testing. And it's a finger prick or a mouth swab, so it's a pretty easy test. It goes out to the for the foundation, and we get the testing back. But it's a hereditary disease that's passed on through generations. And so if you have any type of obstructive lung disease findings, recurrent respiratory problems, we're screening our patients to see if that's a part of the picture. And we find it more than what you would think, right? And there's treatment for it. And so it's a weekly infusion for therapy. So it is a commitment to start treatment. And a lot of factors go into deciding if somebody needs treatment. And so a lot of our patients, we realize they have alpha-1 and they're just a carrier state. They're not deficient. But we monitor those patients closely because we want to make sure that they don't start to become deficient and start to develop emphysema and things like that. So we have a large amount of patients in our practice with alpha-1 disease. And since it is hereditary, once we find a patient that does have an abnormal alpha-1, we recommend all their first-degree relatives to be tested because they're probably carriers too or potentially have the disease process as well.
Wow. Okay. All right. So we have a lung situation. Do we need to be referred into your practice?
So the easiest way typically is that you get a referral into the pulmonary practice. That way we have all of your medical records and can figure out, a trail of where you've had imaging so we can try to get all of your information. Of course, if you've talked about it with your primary and you haven't gotten anywhere and you really feel like you need a referral into pulmonary, you can call our office too to see about getting an appointment. Our number is 812-663-1311. Like I said, we have great support staff, and they are fantastic at getting records and trying to figure out, what is going on. Also, they also triage out urgent referrals. And so they're very good about, a new lung mass, let's see if we can get this patient in tomorrow, right? So we will move our schedules around, try to book patients where we need to try to get patients in for urgent referrals. And that's also what's different about our practice here at Decatur County Memorial Hospital is that we understand how scary a new lung mass is or a new lung nodule. And, we need to get that patient seen, right? And so we are willing to work with you and your primary providers too, moving our schedule around, trying to get these patients in sooner. Sometimes in these bigger facilities, in Indy and places like that, they're so busy. They have so many patients. And sometimes it's just not possible for them to get patients in that fast. And so I think we really try to work people in to try to get people seen sooner rather than later, especially with something like that, to either maybe put their mind at ease or get them in the right direction on figuring out what's going on.
Yeah, that stress factor's awful.
Definitely.
Yeah. Really
yeah,
bad.
and I mean, our primary care providers and the other specialists that are here are fantastic at also trying to evaluate, maybe they go ahead and put a PET scan order in before they get to us. And so we coordinate a lot with the other providers. We have them on speed dial. We're calling, we're discussing results, as well as our radiology department. They're fantastic at really reviewing imaging, trying to decide what's the best option for this lung nodule. And then also our oncology counterparts, fantastic. They have a fantastic staff, great nurse coordinator that helps schedule these patients, get these patients where they need to go. So I think we have a really great networking between all of our providers and collaboration. So then, the aftermath is quality patient care, right? Getting the patient taken care of and actually treating them appropriately and getting them where they need to go.
Well, and just to have the actual practice here, so you're not traveling an hour to somewhere else. And I mean, you're already nervous. You're nervous. Yeah. And you don't feel very well. And so to be able to just take care of it at home makes a big difference.
Absolutely. And that, we want to try to keep people local as much as possible. Of course, there's some things that are more appropriate to be done in the city, things like that with more equipment or technology, but we absolutely try to keep our patients local. We have a lot of subspecialties that are here at Decatur County that can help with patient care. I think all of the practices do a really great job. And like I said, here, you're not a number to us. You're our patient. We treat you like a brother, a sister, a grandma. We want to get to know you and how we can help you too.
All right. Okay. Well, Lindsay, anything else you want to share with us?
I don't think so. I think the only thing I want to reiterate too, like I said, if you're having a lot of respiratory symptoms, it doesn't have to be your normal. Please talk to your primary care provider about it or any of your providers and see if it's time to get a referral into Decatur County Memorial Hospital pulmonary practice. We would be more than happy to see you and to see what we could add to your treatment or what we could do to make you feel better as well.
Do you think that sometimes it is such a gradual maybe decline or decrease that sometimes we don't even realize it ourselves?
Absolutely. And like I said, we start to just compensate and try to work around our respiratory symptoms. And it's sometimes people don't even talk about it with their primary care providers. And so
you just kind of figure it's like
I'm getting older
or, things.
Yeah. And we have a lot of patients that on their first visit, they'll say, well, I think I'm short of breath because I'm getting older and I've gained some weight and I'm retired or I'm anxious and maybe that's why I have heart palpitations and things like this. And we always talk about those are what we call a diagnosis of exclusions, right? So we don't want to just assume that you're short of breath because you've gained 20 pounds and you're now 70. We don't assume that, right? We want to evaluate to make sure we're not missing anything. So never assume that it's because you're getting older, you've gained weight, or anything like that. We need to evaluate those symptoms to ensure that we're not missing something. And is there an opportunity to provide treatment to make your symptoms better as well?
Yeah. Live your best life if you can.
Absolutely, right? It's a breath of fresh air. We got to, and we're here to help you with that breath of fresh air as well.
Absolutely.
Yes.
All right. The number again to your office if they have questions.
It is 812-663-1311.
All right. And you can also visit dcmh.net for tons and tons of information and
Absolutely.
everything that you need there. So, Lindsay, thank you so much for joining us.
Thank you guys so much.
All right. It's the DCMH Health Chat, and you can also, it's on YouTube, right, Tom?
It sure is.
Okay. So it will be available if you want to go back and pick up some pieces of that and maybe get yourself scheduled in. So, all right. Thanks so much for being here.
Thank you.
All right, we'll be back. Tree Country 1330 WTRE.